The surgical anatomy of the neck is complex and highly significant due to the presence of vital structures, including vascular, nervous, respiratory, digestive, and musculoskeletal components. It can be divided into compartments and regions to facilitate understanding. Regions of the neck. 1. Anterior triangle, bounded by the midline, anterior border of the sternocleidomastoid (SCM) muscle and the inferior border of the mandible. Subdivided into submental triangle, contains submental lymph nodes and small veins. Submandibular triangle, contains the submandibular gland, facial artery and vein, and hypoglossal nerve (CN-TWAN). Carotid triangle, contains the common carotid artery, bifurcating into internal and external carotid arteries, internal jugular vein, vagus nerve (CNX), and hypoglossal nerve. Muscular triangle, contains the infrahyoid muscles, thyroid and parathyroid glands, and trachea. 2. Posterior triangle, bounded by the posterior border of the SCM, anterior border of the trapezius, and the clavicle. Subdivided into occipital triangle, contains the spinal accessory nerve, CNX line, brachial plexus trunks, and external jugular vein. Supraclavicular triangle, contains the subclavian artery and vein, brachial plexus, and lymph nodes. Nash fascial compartments of the neck. The neck is enveloped by fascia that divides it into compartments. 1. Superficial cervical fascia, contains the platysma muscle, cutaneous nerves, and superficial veins, e.g., external jugular vein. 2. Deep cervical fascia, investing layer, encloses the SCM and trapezius. Pretracheal fascia, surrounds the thyroid gland, trachea, esophagus, and infrahyoid muscles. Prevertebral fascia surrounds the vertebral column and associated muscles. Carotid sheath contains the common internal carotid artery, internal jugular vein, and vagus nerve. Vascular structures, arteries, carotid arteries. Common carotid bifurcates at C3-C4 into internal to brain and external to face and neck. Subclavian arteries branch into vertebral, thyrocervical, and costocervical trunks. Veins, internal jugular vein, major drainage from the brain and face. External jugular vein drains the face and scalp. Subclavian vein combines with the internal jugular to form the brachiocephalic vein. Nervous structures, cranial nerves. Vagus CNX provides parasympathetic innervation to thoracic and abdominal organs. Accessory CNX9 innervates the SCM and trapezius. Hypoglossal controls tongue movements. Cervical plexus, sensory and motor nerves C1, C4 supplying the skin, muscles, and diaphragm via the phrenic nerve. Brachial plexus supplies the upper limb emerging from C5-T1. Muscular structures, suprahyoid muscles, elevate the hyoid, e.g. digastric mylohyoid. Infrahyoid muscles depress the hyoid, e.g. sternohyoid, omohyoid. Sternocleidomastoid and trapezius, important landmarks and functional muscles. Visceral structures, thyroid and parathyroid glands, endocrine glands located in the anterior neck. Larynx and trachea, airway structures. Pharynx and esophagus, components of the digestive tract. Lymphatics, superficial lymph nodes along the external jugular vein. Deep lymph nodes along the internal jugular vein, draining the head, face, and deeper structures. Understanding the relationships between these structures is essential for surgical procedures such as neck dissections, thyroidectomy, and vascular surgeries.